Personality disorders are rigid, permanent, and maladaptive traits that define the way a person behaves. These traits become embedded early in adulthood and are completely egosyntonic. Because they are ingrained and because they're egosyntonic, patients don't see them as a problem. And it is almost impossible to treat them because they don't want to change. Instead, what you can learn is how to interact with them. Remember, you cannot diagnose an adolescent with a personality disorder because they might grow out of it, though you can spot traits early on. If ever a patient sounds like they have a personality disorder, but it is not affecting their lives in any appreciable way, they are said to have cluster traits. In order for personality disorders to be considered a disorder, it has to interfere with their functionality. We're going to divide all of these patients up, as you can see we've done on the table, into clusters. Cluster A is subdivided into 3 personality disorders: paranoid, schizoid, and schizotypal. Now, you're not going to confuse one for the other, but just know that they are all cluster A. They're all a little weird. The first kind, the paranoid personality disorder, is generally going to be distrustful, suspicious, and interprets others as malicious or malevolent. People around them are doing the same benevolent, benign things they've always done, but these patients think that everyone else is out to get them. They're going to use a defense mechanism called projection. That is, whatever they're feeling, they will think other people are feeling. That is, if they are upset or angry, they think that someone else nearby is angry. If they're sad, they think that you who are interviewing them are sad. The way you handle these patients is to be clear, honest, and non-threatening. You cannot lie to them, and you cannot go back on your word. The second type is called schizoid. Schizoid are loners. They have no relationships, and they're happy not having any. These are the people who are going to work really weird jobs where they don't have to interact with other people. People who are like the nighttime shift toll booth operator when no one's coming across the bridge, or the guy who works for a computer company under the stairs in the basement at his desk all day. They don't want to see people, so they generally don't get in trouble. They don't want to see you, they don't want to see other people, they don't get in trouble, so chances are you're not going to see them. If you have to, just treat them like everyone else. The final kind of cluster A, all the weirdos, is schizotypal. And schizotypal is called schizo because it's almost schizophrenia. Almost. They don't have hallucinations, they don't respond to internal stimuli, but they are bizarre. Their thoughts are weird. They've got magical thinking, like the charm bracelets on their arm keep them safe from disease and harm, or they've got strange, crazy dress and behavior. If you look at this, you might think of well, that maybe just sounds a little bit like a weird religion, and so you don't want to insult someone by saying the thing that they believe in is actually bizarre and magical. So when you think of someone who is schizotypal, I want you to see an image of Lady Gaga in one of her crazy dresses in the middle of a music video. Very eccentric, very bizarre, very weird, but fully functional. Schizotypal personality disorder require people who are clear, honest, and non-threatening to deal with them. Now let's move into cluster B. Cluster B for bad boys. These are the people who are not going to get along with other people and who are going to be very disruptive to society. The first one we have listed is borderline. Borderline patients are unstable, impulsive, and often promiscuous. This personality disorder is often found in women. Now, when you talk about bipolar disorder, we said that people move from a manic to a depressed state. Borderline personality disorders can do it on a dime. They are all of a sudden happy and then snap, and they are in their room crying, ready to kill themselves. The thing is that these patients are going to often have cries for help. These are the patients who are going to have suicidal gestures. That is, they call their husband and say, "I'm going to kill myself, you need to come home," and then drink the pills or slit their wrists. Borderline personality disorders often succumb to fatalities because they time the suicidal gesture inappropriately. They think that someone's going to come home in time to save them, and now they have all this attention, but sometimes their plans fall through and they actually end up committing suicide. You have to watch out for these patients as you deal with them because they will split everyone. And in splitting, you're either awesome or miserable. You're either perfect or terrible. And so if they happen to like you and they split you into the good category, you will often get split against the rest of the staff. You should think of Angelina Jolie's character in the movie Girl Interrupted or the movie Fatal Attraction. People are emotional, flip on a dime, and are just crazy. I'll say it now, and I'll probably say it again towards the end. In Cluster B, patients will try to change the rules, they will be manipulative, and they will be demanding. The way you handle these patients, because you're not going to fix the personality disorder, is to follow the rules. Set those rules and do not deviate. Be firm, but don't accuse them of anything either, because then they're going to start treating you as the enemy. The next Cluster B is histrionic. Histrionic and narcissistic personality disorders are very similar, but try to tease out their differences. In someone who is histrionic, they're going to be very theatrical. They're going to be attention-seeking. They're going to be very superficial and are going to have extreme emotions. These patients can also be hypersexual. Histrionic personality disorder is often found in, again, women. The thing is that they don't have any deep, meaningful relationships. Everything is over the top and very superficial. These patients have a lot of trouble when they get older because they are dependent on their looks or their personality to get them by. As their looks begin to fade and they come out of fashion, they begin to clash with their own personality disorder because now they're not so important and they really try to get that attention back but aren't able to do so. Examples of this are Marilyn Monroe. She was most certainly histrionic and is the quintessential example of hypersexual and attention-seeking. Or you can also think of the movie Gone with the Wind. Narcissistic personality disorder is not so much attention-seeking, but can also be sort of theatrical, superficial with their emotions, and have an extreme style of dress. The narcissist, though, is self-centered. He has an inflated sense of worth or talent, and he will always demand the best, being entitled. And I say he because narcissistic personality disorder is often found in men. So to put them two next to each other, histrionic personality disorder is someone who's going to be theatrical and have ridiculous hats and flowing gowns so that attention is drawn to them. But what they're looking for is the attention. The narcissist may be overly dressed in a suit with a flower pinned to his jacket when he's just going out to the movies because he thinks he's important. You may also see this by him seeing you as a physician and saying, you know, you're not the head of section, so I want that person. The difference really is in the attention-seeking versus the self-centered entitlement. When you think of narcissistic personality disorder, think of the movie Zoolander. And finally, in the bad boy cluster B's, antisocial personality disorder. These are criminals. They have no regards for others. They don't care. They are outside the social contract. They are impulsive and they lack remorse. These patients had conduct disorder as a teenager and they didn't get it fixed. Now they are just criminals. This isn't to say they are sociopaths and don't have response to emotion, but the antisocial personality disorder is someone who is willing to commit crimes and murder and live outside of society's laws because they feel it doesn't apply to them. Think of Tony Soprano in The Sopranos. Unfortunately, and this one is really the one where you're going to see the most because they are by definition living outside of society's rules, and so they're going to come into jail often. And what you need to do is decide, is this person rehabilitatable? Unfortunately, if they really do have an antisocial personality disorder, if you try to treat them, all you do is make them better at lying. They hear the things that you're saying and they're so manipulative that they will get out of you how to be better as a person, but really they maintain their antisocial tendencies. That is, they can fake acting like normal so that people don't recognize their antisocial tendencies and still commit crimes. So if you find someone who is antisocial, they're going to commit a crime, and the only treatment for them is to put them in prison. We're going to finish things up with cluster C personality disorders, and these are going to be the people who are weak, shy, or timid. Let's start with avoidant personality disorder. These patients are shy. They fear criticism and are consumed with feelings of inadequacy. These are patients who want friends, who want relationships, and who want promotions but do not pursue them. They are in fear of being inadequate or being rejected by their peers. So in direct comparison to a schizoid personality disorder of cluster A, who is alone and happy being alone, the avoidant personality disorder in cluster C is alone but does not want to be alone. These are the patients who will often pass up on promotions or giving presentations to get ahead in life because they're afraid of failing or being judged. They are going to come to see you. They want what they can't have, what they think they can't have, and they need you to help them. And thinking of examples of this, I want you to think of the really shy but hot librarian. She could have any guy that she wants, but she just doesn't, instead spends all of her time with books because she fears rejection. Also think of the movie Napoleon Dynamite, where about every character in the movie has avoidant personality disorder. You need to be careful with these patients. You need to avoid power struggles, and you need to make the patient choose, because they are fearful of making any decision and will simply do what you want them to do. So you need to make sure that they actually take control of the situation and make their own choices. Dependent personality disorder are patients who are submissive and clingy. They need to be taken care of because they also have an unrealistic fear of rejection. This is probably the saddest of all of the personality disorders, because this is a patient who is the stay-at-home mom in the abusive relationship who refuses to leave her husband. She needs other people to make decisions for her. In fact, a great example on the step exam is going to be a patient who comes into your office with her husband, and the husband tells you all the information and makes all the decisions, and she just sits there. So you need to give this patient clear advice and make sure the patient does not sabotage their own treatment, because if they don't have a spouse to become dependent on, they may become dependent on you. And in doing so, they're going to sabotage their treatment so they can come back and see you more often. We're going to close with the obsessive-compulsive personality disorder. And I have to say that this upfront is not obsessive-compulsive disorder. Obsessive-compulsive disorder had intrusive thoughts, the obsessions that resulted in the mandatory compulsions, the actions which eased that anxiety. That was ego-dystonic. Obsessive-compulsive personality disorder is ego-syntonic. They have an extreme preoccupation with orderliness, control, order, and perfection, and they do so at the expense of efficacy. This is going to be the student who has to redraw her notes 75 times because she dipped underneath the line on the 8.5 by 11 grid sheet, or the colors weren't exactly the right shade of blue, so she starts over and does everything again. A TV example of this is the television show Monk, where there is a detective who has to have everything in exactly the right way, and because of that he's able to identify strange things that other people miss. So as you review these, it's simply a matter of memorization, which is why this lecture is given the way it is. If you memorize a table, likely you'll get them all right. You really won't confuse one for the other, except for maybe avoidant personality disorder versus schizoid and histrionic versus narcissistic. Those are the only two you might have trouble differentiating. Otherwise, it is up to you to simply memorize the table and practice with some questions. That is personality disorders. Become a better doctor. Subscribe now to get access to our premium content.